sort of a pop quiz. Is there any time that we should not have information security? And this is a random photo of just like your typical American family. Does this have anything to do with information? Does anyone see a reason why what this has to do with information security? Does anyone have any idea?
Yeah, risk a second.
It's not private. It's not secure, and you're not accountable, and you can't authorize users.
So you're already looking at the goals. That's a great way to look at it. So here's a problem. It's sort of subtle, but first of all, does anyone recognize that peak?
Half dome.
That's Half Dome. That's in Yosemite. So this was posted to Flickr with a date and timestamp saying we posted this to Flickr in a public venue with a date and timestamp. So suppose this was a Friday afternoon that they posted this photo to Flickr in a public forum. Anyone can see it. They can see the families in Half Dome. Anyone can see that. Turns out this person also has their name on their Flickr account. So I can run a reverse search on that person's name to find property records, see if they own a home, find out their address, go to their home, rob them blind, because I know they're in Yosemite. So when people say things like, well, I just have family photos and stuff like that, sort of like drives me crazy, because it's like, this is exactly what someone can do. They can take advantage of the fact that you didn't responsibly control your information and use it to hurt you. Even though you had no bad intentions, someone else could abuse it. So the idea is, unless we have a specific reason to want to disclose information, we should choose to, by default, protect it. Does everyone follow that logic? So protect it by default if we want to. So when we're putting out a press release, the whole point is to make it public and to give everyone information. So that's the point. Obviously, I'm not saying don't do that. What I am saying is you should have a specific reason. And they probably didn't get robbed. They're probably just fine. But if they did get robbed, boy, would they feel like idiots. Like, oh, you shouldn't have posted that photo on Flickr. You wouldn't have gotten robbed. So we're in healthcare marketing. So whether it's websites, newsletters, media placements, press releases, TV interviews, basically a ton of what we do is focused on the availability part of information security. We're trying to make information available, and so just by the nature of what we do, we really focus on the availability. And we believe that patients should be informed. That's sort of part of our mantra here is patients, informed patients are better patients. So. But not only that, we also think that we place a pretty strong emphasis on integrity and authenticity and trustworthiness. So we're not trying to put out just crap information. We're trying to put out good information, reliable information, trustworthy information. This is critical in the healthcare field because people are, even though we're maybe disclaiming that they shouldn't rely on this information, people are reading the information and they're becoming educated on that. So it's really important for us to be authentic, trustworthy, and have the full picture as far as integrity goes. We also believe in accountability, right? So the whole purpose of us doing all this is that our clients can benefit. We need to have accountability, right? So we're covering accountability by saying our clients produce this information. Our clients' websites are the ones providing the information. That's why Google is giving us traffic to our website, because of accountability. So accountability is also important. So all these things are sort of intuitive, like part of marketing is doing all these things. So we almost have the full picture of information security. We've covered all the bases except for confidentiality and privacy. And if we miss those, we're doing a huge disservice to ourselves and our clients. So in the past, information was sort of secure by nature of it not being available. If you have a bunch of medical records in a filing cabinet in a single doctor's office, like that's really hard for someone to steal. It's not available to anyone. Now that information is becoming readily available, we have to pay attention to confidentiality and privacy in order for us to do the best work that we can. In regards to healthcare, there's a word PHI. We've all heard it here, but let's just confirm. PHI is protected health information, and all that is when you connect an identity to a piece of health information. So if you think about, there's a woman named Jane Doe. Nothing I can do with that. There's a woman that's depressed. There's nothing I can do with that. Jane Doe is depressed. That's a big deal. I've just connected the identity to the health condition, and that is a really big deal once you connect those two things. So that's what we're talking about when we talk about PHI. It's connecting the identity to the health record. You've got to think, if we know Jane Doe is depressed, You might think like that could be sort of a bad thing, but like let's just like talk about how bad that could be. Jane Doe, as a victim, could suffer stigma, embarrassment, discrimination, financial implications. She could have job implications, and she could have health losses. A fraudster that knows that she's depressed could use that to illegally obtain drugs or health services. Once that fraudster illegally obtains those services or drugs, her medical record could be contaminated. She could have reduced credit. She could suffer legal costs. She could have increased premiums on her insurance, and she could have her insurance terminated. The effects of a privacy breach and security breach in health can be just devastating for an individual. There's also the fact that if she doesn't actually trust her doctor to keep her information private, she might not want to disclose that. Does anyone sort of like feel that intuitively? Like if you don't really trust your doctor to keep your information safe, you don't want to tell them that you are depressed. And that could affect how they're going to treat you. That could have a really big impact in how your health care is managed, and that can really diminish your health care by the nature of not having security in the privacy and confidentiality realm. So in healthcare, like, people see it in different, boxes. Like there's bank security, there's privacy security. It really applies to everything that we do. But I think the reason why there's a lot of focus on healthcare and, HIPAA and HITECH Act is because the effects of privacy and confidentiality breaches are so devastating. I pulled some numbers, and the U.S., I think this was 2013, spent $2.9 trillion on health costs. I also pulled up some numbers on what percentage of our health costs are related to fraud, what percentage of our health costs are related to insurance collection issues, things to do with like having a poor information system. And based on those estimates that I pulled from public resources and government databases, I actually was able to estimate that bad information security protocols are costing us in the realm of $300 to $400 billion every year. It's unbelievable. But I actually then went to check, what is that comparable to? So that's how much we spend in college education in the United States every year. The amount that we're losing in by having bad information security protocols is the exact same amount that we're spending in college education. That's how big of a deal it is. It's huge.
300 to 400 billion a year.
300 to 400 billion a year is my estimate. That's huge. So can you sort of take a guess at what I feel and think when someone says something like, well, privacy just doesn't really matter, or I don't have anything to hide, I'm just having like family photos, or privacy is just too complicated. Things like that, it drives me crazy, right? You can sort of imagine that after me talking about it. But I'll actually tell you what it sort of reminds me of. In 1976, Steve Wozniak pitched his employer. Everyone knows who Steve Wozniak is? Anyone not know? He pitched his employer, Hewlett-Packard, to produce a machine that he was calling a personal computer. There were computers, but he was like, we could do a personal computer. He pitched this idea 5 times to Hewlett-Packard, and they kept saying, it's a bad idea. So he teamed up with a guy named Steve Jobs and produced what was now called the Apple I. And we all know what happened from there. So when I hear people talking about privacy is important, things like that, you're just as ignorant as Hewlett-Packard was. So encryption, as far as information security goes, is, by the way, I had a picture for that. That's the Apple I.
Oh my gosh.
Just the one that just sold for $200,000?
Exactly. That way, so when you look at it, it's sort of rough around the edges, right? Like it was, you could sort of get like, well, Hewlett-Packard sees this and like, well, that doesn't seem like a great idea. But it actually was a great idea.
There's a story about how they were like soldering the motherboard with the kitchen table.
Yep.
And Steve Jobs.
But the idea that was that that people should have access to to these devices, and that really was transformative. And I think I've shown in how it transformed our transactions as far as currency goes. Like it is a huge deal that these things can be transformative and revolutionary in our society. And I think that there's also the argument that, it's too complicated, it's too hard. Well, raising children is hard, but people buy books about raising children. They read books about raising children. Millions of books every year are sold. How to raise your kids, what to expect when you're expecting. In fact, the What to Expect series I looked up has sold 34 million copies, that one series. So people value raising children, so they learn about it. So it's our duty to value security, privacy, and confidentiality and learn about these things.